Okay, ooh, it's over on the right side now, I know. The little live red button moved, where it's not in the same spot it normally is, so. Welcome,
Oh,
Kelly, nice to
yeah.
see you.
Nice to see you too. Thank you.
So committee, this afternoon, we are in our O&A Oversight and Accountability section. We're gonna be taking up a update on syringe services, and this is in relationship to implementation of Act 2020. It was Bill 222, Act 22 of 2023. Thank goodness it wasn't 2022, right? We are happy to have Deputy Commissioner Kelly Dougherty here. And Kelly, you've been here before, so we don't need to do introductions. And members, we do have a copy of a PowerPoint that Kelly provided to us on our website. So the floor is yours, Kelly. Thank you for being here.
Sure. And just for the record, Kelly Dougherty, Deputy Commissioner. And at first, especially since there are some new members on the committee, I thought I would just give a brief overview of what a syringe service program is and what services they provide, just to kind of have a base level sort of understanding of what we're talking about. So organized community-based needle exchange programs, also referred to as syringe services programs, or SSPs, as we like to call them. They're community-based prevention programs that provide people who use drugs or have a substance use disorder with a range of services, such as clean use supplies for like injection equipment, syringes. They provide links to substance use treatment and other services, including medical services, and they help prevent the transmission of infectious disease. So they protect the public and first responders by providing safe disposal of the needles that individuals bring into them when they're getting new supplies. So there's been a lot of research on SSPs, and they've been around for, over 30 years, that they're safe and they're effective. They are cost saving. They don't increase illegal drug use, and they reduce the spread of viral hepatitis, HIV, and other bloodborne infections. The more syringes that are provided per the number of people who inject drugs, the more likely used syringes would be disposed of safely. So the idea is folks come in, they can bring their used syringes, the SSP will dispose of those and provide them with clean syringes for their use. I do want to say that at some point, it may have been in the early 2000s or maybe sometime in the last many years, CDC dropped the requirement that it's like a 1-for-1 exchange. So people don't have to sort of bring in 2 syringes in order to get 2 syringes. It was determined that that would be a barrier for people that it would discourage people from coming in. So, but people who do bring their used syringes, SSPs are required to have a disposal program, to have a way of disposing of those syringes. And that's part of the operating guidelines that the department has for syringe service programs. So that requirement is in the grant agreement that we have with them. So like I said, they refer to treatment, and they also provide information on, how to recognize an overdose. They distribute naloxone and other supplies, to help people who are using drugs. Like I said, they provide connection to community services. So I'll pause there and see if anyone has any questions about that, and then I can move into updates since Act 22. All right.
I'm not seeing any. The 2 people who would most likely have questions are not in the room right now.
Okay.
So thank you for that overview, and hopefully the representatives will review your testimony. Thank you.
So since Act 22 was passed, this is not necessarily related to Act 22, but it sort of happened around the same time. There are over 80 locations statewide that have drug disposal kiosks, and some of those do accept sharps. Some don't, but the department, our website publishes available locations and the types of materials accepted. So folks can, dispose of needles in some of those locations. So the department, like I said before, does administer grants to SSPs. And the SSP, like I said, must meet the operating guidelines. So they must maintain a sharps disposal collection plan. There was, per Act 22, the Department of Health and the Blueprint facilitated regional stakeholder meetings regarding public needle and syringe disposal programs with the goal of determining appropriate placement of syringe disposal programs. And that was completed in January of 2024. And that report, I believe, was shared with you. If you don't have that, we can certainly send it along. Actually, I think it may have been shared with you from Natalie Weil, our policy advisor. In Act 22, there was $150,000 appropriated from the Evidence-Based Education and Advertising Fund to the department to provide grants and consultations to municipalities, hospitals, community health centers, et cetera, on needle and syringe disposal programs. So this was one-time funding. All $150,000 is obligated to 2 organizations. And so the grants are for providing opportunities for these entities to develop syringe disposal programs in community settings. Additional disposal opportunities that could be like locked disposal boxes in public places like restrooms or parking garages, what have you. We did this via an RFP, and 2 vendors applied and both were selected, and they are both in the southern part of the state, Windham County and Bennington County. We did significant outreach through our listservs, through our prevention consultants that we have across the state, prevention organizations, our field service, AHS field service directors, and our VDH district directors. And we just had those two entities apply. We actually did targeted outreach to the city of Burlington, but they didn't submit a proposal. So it's AIDS Project of Southern Vermont, which is in Brattleboro. And I'm blanking right now on the Bennington entity, but I can let you know if you'd like to know that.
Thank you.
So in addition to that, $350,000 was allocated via Act 22 for grants from the Opioid Abatement Special Fund to fund syringe services programs to increase the geographic distribution of these services and to establish a new SSP. So unfortunately, we did release the RFP. 1 entity responded, but that applicant did not. The application scored less than 50 points on a 100-point scale, and it was not consistent with the operating guidelines for SSPs, which were provided to them. So we had to reissue the RFP, and that is, I believe it's out right now. So those are the things that were in Act 22 regarding SSPs. Happy to pause and answer any questions.
Go ahead, Representative McGuire.
What are the requirements to be an SSP provider?
So they actually were just updated. So you used to have to either be a designated HIV service organization or a healthcare provider, but that language was loosened last year. So now I don't recall off the top of my head what it was changed to, but it did broaden it so that you didn't have to be either one of those things.
Mhm.
So as a result, we have a new SSP, Vermonters for Criminal Justice Reform, that is operating in Burlington. They previously didn't meet the requirements, but now they do because of the loosening of the language. And I can certainly find that in statute and send it to you.
Perfect, thank you.
Mhm.
Other questions? Go ahead, Representative Bishop.
Yes, if you could help me, I'm trying to keep track of the various numbers you shared with us. So how many SSPs are there? Is that how many SSPs are there?
Yeah, so there are, I want to say 4 organizations, and there are multiple locations, at least with one of them, but also mobile services that travel to places where there isn't a standalone SSP. So like Vermont Cares, has a mobile service that they take around to other communities where they don't have a fixed location. But I can send you a list of those SSPs and where they serve.
That'd be great.
Kelly, one of the things I recall during our conversations on H 222, which eventually became Act 22, was because I think there was a proposal at one point in time to have the syringe boxes located at pharmacies or near pharmacies, and the pharmacies weren't particularly enthusiastic about that. And we ended up, and maybe it was in a different bill, but we've done a number of opioid bills. So I recall there being some money allocated to have conversations with communities themselves about where would be best locations. And there were some resources in there to do that. And about like where in communities would these depositories best be located.
I don't recall that there was funding allocated, but there was that report that I referred to
Yeah,
based on the stakeholder engagement across the state, and that does touch on where services are needed. So I would refer you to that. It's
okay.
a comprehensive report.
All righty. I think and you said that was submitted last January?
I think that actually Natalie, while our policy advisor, sent it again today.
Okay.
So
Okay. What I have that she sent was just your testimony.
oh, okay. I can.
Oh, this is the
survey.
report
Yeah. This
at
is
the
the
end.
report.
Sorry.
Yep. That's
Sorry.
okay.
She did. Yep.
Okay, great.
That has a graph.
Yep.
That's every this one.
I just went past it. No, that's two.
It's.
All right. Thank you.
Mm-hmm.
There we go.
Everywhere.
Yeah. Everywhere.
Yeah.
Right. I know. Okay. All right. Thank you. That's
Mhm.
helpful. Other questions on this? And I would encourage people to kind of take a look at this report because it might actually help inform further questions about this. One of the reasons that this came up, other than it should have been on our tag list to follow up with you on, is we had a representative who was interested in amending the opioid abatement settlement fund bill H 218 to put language in that actually is already in Act 22 or something comparable, because a constituent of hers had been concerned about the needles in Burlington in particular, but we've certainly heard it from other communities
Mhm.
around the state. And to what extent, do you know to what extent that the syringe service providers typically receive needles from people who coming in seeking exchange?
I don't, but I can see if we collect data from them on that. I don't know off the top of my head, but I can see if that's a component of their reporting. I don't know if it is or not. But like I said, they they do have, they all need to be able to receive and dispose of used needles. So it's not a requirement of them to go out and clean up syringes found in communities. That's not a requirement for them. But they will accept ones that people bring into them for proper disposal.
Right. And it actually was helpful to hear you comment on the fact that CDC does not require it as a, or at least not currently, as a best practice in terms of this because of the likelihood that it would deter people from seeking out these services. So that's helpful information. Other questions for Kelly on this? Go ahead, Representative Bishop.
Although tangential to the programs that we're talking about, it was just referenced Burlington. And are you aware of Burlington or other communities having programs, perhaps not connected with this, that do seek to be out in the community collecting used needles that are discarded?
There are various community disposal efforts going on outside of VDH, like that we don't have anything to do with. I'm not aware of anything in Burlington other than the service that they have where you can, what's it called? Like
Click edit.
see click.
Yeah.
Yeah.
Familiar with
Yeah.
that.
So that's the only thing I'm aware of, but there could be things going on that don't involve the health department. And so I'm not really sure. But the other thing that was attached to the document that was sent to you is a toolkit, a syringe disposal toolkit for communities that was developed actually by our Barry district office several years ago. And so they shared sort of their experience and put together a toolkit so that communities can use that as a resource to set up disposal programs.
Thank you. Any other questions for Kelly on this topic? Yes, I see Safe Sharps Disposal Community Toolkit. Okay.
What page is it? Eric's got a question.
Go ahead, Eric. It is, what'd you say? 16, 17, right around 16, 17.
Thanks,
Go ahead,
Kelly.
Eric.
It seems like this program, it's a very, very effective program, don't get me wrong, but it seems like it's very underutilized. You had mentioned that there's only a couple of providers. Many of the main locations are in the southern part of the state. What can we do to get this program more utilized?
Right. Well, to clarify, the ones that I mentioned that are in the southern part of the state is specific to a disposal program, not an SSP. So we were appropriated $150,000 through Act 22 to issue grants for communities to establish safe needle disposal programs. We only heard from those two programs down in the southern part of the state, but SSPs generally are, I can't say that they're statewide, they're not in every community, but I am going to send a list of the organizations and locations. And like I said, Vermont Cares does operate a mobile SSP to try to reach some of the communities that don't have a fixed location.
Yeah, so I guess my follow-up would be, what is it that we can do with maybe as legislators or things within the agency to maximize and if it's a barrier thing, if it's maybe dropping some of the requirements to where this is really maximized throughout all our communities. We just heard from Representative in Burlington recognizing, hey, some of these things are often here. We do have, several of them down around here in the Rutland area. Yeah, again, I see this program is significantly underutilized, and we know how effective it is at reducing the, the stigmas and the other things surrounding drug use.
Any other questions or comments for Deputy Commissioner? I have one. Is there an acting commissioner been appointed, Kelly?
Yes, Julie Orell is the other deputy commissioner at the department, and she is serving as interim.
Interim. Okay, thank you.
Mhm.
It's not related to this, but, the other bill that we have you coming in on, I guess we're going to wait and have, all the AHS folks come in together or not, that's not happening. Yeah, okay, you're gonna come in tomorrow, okay.
I was gonna
As you
come
can
in-
imagine, I
Yeah,
was just gonna say, as you can imagine, section 4 of that bill has caused quite a lot of, communication with our committee now, and everybody and their brother wants to testify about it. And so, we are, and of course, people have differences of opinion about, whether we should or, should not repeal that section of statute. So, I was just trying to figure out, it's just helpful to know, but was that something that the health department requested be added?
I don't think so, but this, I think I mentioned before, this sunrise provision has been
Right, it's been there
kicked
for a
down the
while.
road
Yeah,
for many, many years. And so what's happened is the date keeps getting pushed out. And the reason for that is because there really is no good alternative to using DOC. Because there are no other secure locations that somebody could go to. So eventually, after being delayed, like the date being pushed out multiple times, it feels like repealing it is the right thing to do.
yeah, I'm just trying to figure out who's asked for that repeal. And it seems difficult to figure out right at this particular moment because, it wasn't in the bill as introduced and they didn't take any testimony on it downstairs. So,
Mystery.
huh?
A mystery to solve.
Well, it's a mystery that we'll solve eventually, I'm sure. So we'll talk more about that tomorrow.
Okay.
But we did hear some interesting testimony from Northeast Kingdom, Human Services. We're going to be hearing from Lamoille County. I suspect this is something where we're not going to have a universal consensus, would be my guess. So we'll do our best to, figure out what's the best that we can do at this point in time. So,
Okay.
okay, thank you for being here this afternoon. Appreciate it.
You're welcome.
All righty, take care.
Bye-bye.
Okay, committee, at 2, we have H92, and we are going to be hearing this, that's on the Human Services Board peer hearing proceedings. And we are going to be hearing we heard from legal aid and the housing side of things last week, and different types of hearings are handled by the Disability Law Project. And so I wanted them to be able to present their thoughts about how they have interacted with the Human Services Board on that. And then earlier today, or maybe it was last night, I forwarded to you the H293, that's an act related to health equity data reporting and disclosure requirements. That's just an FYI. We will be voting on that tomorrow at 9. So I just wanted to give you a heads up on that. Okay. All right, you've got